Hello, everyone. I'm Michael Clark here at the LTV Media Center in Wayne-Scott, New York. It is Thursday, March the 26th, 2020. Right?
Yeah, that sounds so weird still to me.
It does.
It sounds so weird.
Yes. Well, we have a lot going on today, so
Yes, we
we're
do.
going to get right down to it. This is my counterpart, Morgan Vaughan. Hi, Morgan.
Hi, Michael.
We'll be talking. We'll do our usual thing. We're going to be doing some fast facts, talking a little bit about the stimulus package. Bridget Fleming gave an update yesterday that we're just going to do a quick review on, and then of course give some local information. Talking a little bit about food, because what's better than food? The food pantries. A little bit about Meals on Wheels. We have a little update from Southampton Hospital, and then some random acts of kindness. And then after that, you had the opportunity to interview the town supervisor, Peter Van Scoyoc,
Yep,
who I
Peter
interviewed
and I
last
met
week.
earlier, and we recorded just an update from the town. And so
Great.
that'll play right after we talk.
Okay, and then right after that, we have a great video done by Mike Lavin, one of our team, with this guy.
This guy who's
This
on the cover
guy
of the
here,
Star. Yeah.
Yeah, Captain Chuck Marici, who's on the cover of the Star, and is doing. It's a wonderful video. You have to check it out.
Yeah.
Of some of the things
Really
that
captures the spirit
he's doing.
of what we're doing.
Yeah.
I do have to say, when we were speaking with Peter, the Wi-Fi cut out for a second, so we're just going to cut right back in. So there'll be a little dip in the recording, but
Yep.
that's all it is.
All good. A lot of things happen on the
A lot of
network
things
these
happen, yep.
days. So yeah, everybody's in there. So let's get right to the facts. Most of you probably know that the Senate unanimously passed the biggest economic stimulus in this country's history, $2 trillion. So now it's on to the House and then on to the President, where it's nearly guaranteed that it's going to be going through. The focus on those things is going to be the economy, vaccines, we talked about this yesterday, emergency response, unemployment and workers, and food aid, and then, of course, the healthcare industry.
Right. Our governor, Andrew Cuomo, is not very pleased with this.
He's not been
package.
very happy these days.
He is not. He said that the $2 trillion stimulus package making its way through Washington would be terrible for New York State. New York's government would get $3.6 billion, the governor said, not enough to bridge the virus-related budget gap the state is facing. And Mayor de Blasio went further, calling the deal immoral.
Wow.
He said New York City would be getting only $1 billion, despite having 1/3 of the country's virus cases so far. Citing various projections, the mayor also said that at least half of all New Yorkers could contract the virus. So that is their opinion on that.
Wow. Yeah.
Yep.
So that's interesting. They did so much talking about on the last Trump press conference.
Right.
About
About New
how
York, right.
New York being the epicenter, but yet I guess Cuomo's mad.
And the
that-
before last, so I
Right.
think it was Wednesday night.
Okay, right. Yeah.
Or no, Tuesday night, pardon me.
Oh,
Tuesday
they're
night,
all
right.
together.
They're all
Right.
together, you know. I think that was interesting about what I've heard Cuomo say, and I think I hope this isn't right, but it seems like it's pretty reasonable that New Yorkers are really the canary in the coal mine right now.
Wow.
We're the ones who are going to be showing the rest of the country what's coming. And so that is that's part of why we want to get everybody here better quickly so that we can start giving out the medical supplies to other states.
But we can't do that unless we have the supplies to do it.
Right. And we can't do that unless we get better first.
Right.
So
Yeah.
that's what this is all sort of about, is that the
Yeah.
virus is, and the rural communities are not experiencing it right now. I mean, you have Texas, you have maybe Dallas has it, but all the other places don't have it like we do in New York. So, I mean, you can understand that that's a conundrum.
Don't worry, we'll be good by Easter. It's not, you know.
Stop it. These
so
are facts.
Those
These
are,
facts.
oh, that's right. That is right. Excuse me, folks. Right, that is not a fact. So let's. I'm just going to hit a little bit on what
Sure.
Bridget Fleming was talking about yesterday, more along the lines of Suffolk County, that the cases are up to 2,660. And of course, these numbers are ridiculous because by the time I'm done with the sentence, they've raised and changed.
Right.
But generally, about 27% of the people that are tested are testing positive, 1/3.
Right.
So, which I think has been fairly consistent.
Well, remember also that those people who are being tested are sick.
Well, yeah.
pretty much. You know what I mean? So that's what's interesting to me is that I'm not getting tested because I'm feeling well
Right.
and I don't have any symptoms.
Right.
So what is the real viral load or whatever they call it that's out here? I mean, no one knows.
We do not
What I
know.
thought was interesting about the statistics from Suffolk County that I think that Bridget was going from was that between Tuesday and Wednesday, the cases went up 380 in one
Right.
24-hour period. That's what we're talking about.
Right.
This
But
is
then once
happening.
again, how much testing took place during that period,
That's true
right?
too. Right. Right.
So, yeah, it's a tough thing to put your arms
Right.
around in terms of how
what the
quickly
real numbers
this
is.
is coming.
This is
Yeah.
what the epidemiologists are saying is that we can't tell what's going to happen, and that's why we needed testing a month and a half ago, 2 months ago.
Epidemiologists.
Epidemiologist.
Okay.
What did I say it wrong?
No,
Clark,
no, I'm not.
You're killing me.
I'm just not used to those four-syllable words. And,
I think it's actually 5 or 6 syllables, but that's
math
okay.
is not my strong suit either. So, let's get on to locally. 49 cases so far in Southampton, 12 in East Hampton, the towns.
Actually, Peter said it was more up to 15 now.
Oh, is it? Again, so there you go. I
Yeah.
got this, and then, you talk
Right.
to him. Southold, let's do about
Yeah.
114, and then about 40 in Riverhead. So that's kind of where we're at with the numbers. So what are we hearing from Southampton Hospital?
Well, we talked about this the other day, and I think that the press release that they sent out was pretty much about what we had heard, and we were talking about. The one thing that I thought was different that I didn't know about, and maybe I think this might be new, is that Stony Brook Medicine have established a coronavirus triage line for the community.
Okay, that's good.
So that's a hotline that you can call, and I will put the line up at the end. It is 631-638-1320. Registered nurses are available to answer calls from 8 a.m. to midnight, Monday through Friday. And for information about COVID-19 testing in our emergency department, in English and Spanish, please call 631-726-FACT. So I will put all of those numbers up at the end so you can look. But that is one of the ways that they're trying to triage people before they even get to the hospital.
Right. Okay, that's great. And then along the lines of food, because that's obviously a very important thing, and this is just a minor point, but the village has cut back on the codes for signage.
Yeah.
Because that's always been a very tough thing in the village.
Yeah.
So they've kind of loosened that up a little bit so people can advertise the fact that they're doing takeout or whatever, and
Right.
not have to deal with any of that.
Right. I took a picture of 1770 House, and it says takeout on it in the windows.
Oh,
So
does it?
I think people are starting to do that right away because they want people to know that they're there to offer takeout and delivery. I
Yeah.
have that picture too.
Yeah, I thought it was pretty clever over at Luigi's over in I don't know if that's Amagansett, East Hampton. I think it's East Hampton still. But they have the two windows along the side that are just regular windows. They made one an order window now.
Oh,
and one
really?
a pickup window now. So
People are so inventive. I love it.
yeah, it kind of makes it a little easier. So the East Hampton Food Pantry, they have a lot of things going on, but of course the supplies are being depleted extremely quickly. So they're looking to see if people can start kicking in their direction.
And I put up East Hampton Food Pantry, Meals on Wheels, and the Montauk Food Pantry. So those are the places right now that need donations or they're there to help people.
Yeah, it's great. What I think a lot of people don't know, though, about like Meals on Wheels, they cannot accept food donations.
Okay.
But they can be supported by the IGA in East Hampton, the IGA in Montauk.
okay.
I think there's something that you can buy there, and you help them out. So, and then along the same lines, the East Hampton Food Pantry, and it kind of leads us into one of the favorite things that we like to talk about, like the gentleman with the fish, is these random acts of kindness. And there's a good example of one here in the food pantry. John Kawalanka, who many of you might know from Art of Eating Catering, but is also extremely involved, a board member of the East Hampton Food Pantry. He needed help getting pallets of food from Hauppauge back here to East Hampton. And so all he did was he picked up the phone, he called a friend, Michael Derrig. He's the founder of Landscape Details in East Hampton. And because he knew that they had a large fleet of trucks. So what they did was they took those over and got all the food and bringing it back. And now
Wow.
that's kind of part of the process. And Michael Derrig says that, you know, yeah, we need it. We need the food. And the need for the food is growing much faster than the food that's coming in.
And the need that for food that can get to people's houses because they're staying inside.
Yeah, exactly.
You know, so that we don't have to go grocery shopping, or, you know, somebody who's susceptible doesn't have to go out in the world. So that's fantastic.
And it's just, you know, one of those things that you don't think about and you take for granted a little bit. But, you know, here's a guy who has a business and somebody else, a friend of his, reaches out to him. And just those 3 pallets, let me see if I can find this here. Yeah, those 3 pallets of food will help feed more than 20,000 children, elderly, and family members who rely upon that resource.
Wow.
I mean, that's huge.
That's amazing.
Right, just one person getting over there and doing that. And Derek said that he's always glad to help out, and now more than ever, our community has to stick together, even though we're social distancing.
Right.
Right. So,
And also I've been hearing a lot about Round Swamp Farm, which has been busy cooking soup and delivering all of a sudden surprise groceries to people. They have been really stepped up, and people are raving about them.
yeah, there's
right now.
so many of those stories.
Yeah.
It's so heartwarming.
So great.
And one other thing, and I just got this just before I came on the air, so forgive me for the small print here, but East End Cares, that we've been doing a lot of talking about, they, along with the Clamshell Foundation, have launched an emergency 5 for Food campaign for the local food pantries to help bolster the local food pantries. And so what they're doing is they're spearheading this campaign with Corey Peters, who's the president of the Clamshell Foundation, and they're asking for just a $5 donation, and if everybody joins into the $5 donation, that money will go directly to provide emergency food for the East Hampton Food Pantry, the Springs Food Pantry, the Sag Harbor Food Pantry, and the Montauk Food Pantry. And that donation can be made on the homepage of the Clamshell Foundation.
Okay. Oh, great.
Which is a 501c3, by the way, a nonprofit organization, at clamshellfoundation.org. And just going on there, you could just make a $5 contribution. And they actually contacted us for us to broadcast that on the show to get the message out to people. So we're doing that. Bill Kalbacher is actually the CEO of the Clamshell Foundation, and he said that he's so thankful for East End Cares, who have been doing so much since this has come together, and volunteers are going in there and all kinds of different things. So
Fantastic.
What else you got?
Well, the 2 big things that I thought would be of major interest to people is that Altice USA, who owns Optimum, they're offering now they're our local internet provider, pretty much. They are the parent company of Optimum. They're offering free home internet access for 60 days to any new customer.
Okay.
Where it provides service as long as there is a student in the household, which is K through 12, and college students who are home. So to enroll in this program, it's 866-200-9522, and I will have that number at the end. So if you don't have internet service, they're trying to, level the playing field for everybody. So
Sure.
everybody can get access to the online learning that we've been hearing so much about. And then Joe Shaw did an amazing job in Southampton Press gathering a bunch of information for places you can go for help. You definitely look at this article. But one of the things that I thought might be of interest to people is that homeowners with mortgage payments due, the state is offering a 90-day break on mortgage payments with no penalty.
Wow.
How to get it? Automatic, though a call to your mortgage provider to confirm is always a good idea. So that is something that may make a huge difference right now while we're waiting to get these checks, and we're waiting to see what's going to happen with that, and while so many people are out of work. So you won't have penalties, et cetera.
Wow, that's great. And it kind of ties into what we were talking about yesterday in terms of the first thing you were talking about, Altice, is that, how do we have these online classes and stuff like that, and then they're trying to filter in the little computers for the kids to use, but what good is that if
Right.
we don't have the
Don't have the library, don't have Starbucks, don't have all the places that you can
but
go
now
usually.
this will help with that.
Right.
So it's great. So
Right.
this is so wonderful. People are all coming together.
Yep.
So, yeah, so already we are out of time.
I know, it's
But it
amazing.
goes
But we
quick.
still have Peter, though.
We have Peter right after this, and then you have to watch Captain Chucky Marici.
He's
You
a
have
great
to
guy.
watch the video. He's just he's classic Montauk, in my
Yeah.
opinion. It's
And such a spirit of the community. Really great.
It's going to be good. Well, so thank you very much, everybody, for tuning in. Thank you, Morgan. Thank you, Jason, behind the glass, as always. And we will see you guys tomorrow, 5 o'clock. Thanks so much for stopping in.
So here we are today, March 26th, Thursday, with East Hampton Town Supervisor Peter Van Scoyoc. Thank you very much, Peter, for taking the time to be with us today.
Thanks for having me on again, Morgan.
What is it that you want to let people know in the town of East Hampton?
Well, there's a great deal I'd like to let them know, but first of all, I wanted to say that we're handling this pretty well. I'm so pleased to see so many people really taking the strong advice to stay home, to only go out if absolutely necessary. This is critical in slowing the spread of this disease. I've driven here to work. I'm working in the office somewhat, as are some other staff members, but generally only a few people in an office. We're keeping our distance. We're following safety protocols and hygiene and whatnot. A lot of town staff are now working remotely. And we're encouraged that others are doing that in the community. Again, please stay home. That's the biggest thing. That's the most effective tool we have in East Hampton to deal with this situation right now.
Okay, great. I was wondering about what happened the other night. You said you guys did a great press release yesterday about the White House task force the other night, talking about people who were coming out here or coming out anywhere, leaving New York City, and they should self-quarantine for about 14 days. What is the town doing about that? You're just suggesting that's a good idea?
Well, I personally think that everybody at this point should just be hunkered down. We shouldn't be traveling from one place to another, shouldn't be going to second homes. It's shelter in place. And so I think, I've encouraged additional restrictions be put in place. I've sent a letter to the governor today expressing that we would like to have more local authority over the restrictions of what are essential businesses. That's still a concern for me. We still have a lot of trades that are continuing under the governor's ruling that they're essential businesses. I think we need to further refine. Our resources are restricted and limited here. Mm-hmm. I want to reassure everybody that the food supply chain is in good shape, and a lot of the initial, panic buying has subsided now. People are, being much more careful about going out, and therefore, are avoiding the grocery stores as much as possible and only going out when it's really essential. And I think that's extremely important to continue that practice. And again, all the basics, washing your hands, decontaminating and disinfecting surfaces that you have. This is going to be a while before we get through this. The governor's, I think, done a tremendous job and being very aggressive in addressing this. But I think we can fine tune that out here in East Hampton. But if we get the authority to do so, currently I don't have that authority under the governor's executive order. That's pretty much limited my ability to have more restrictive orders put in place here locally.
Do you have any idea? I mean, I know you don't have a crystal ball, but do you have any idea how long this could go on for?
I don't think anybody really knows, but I do think, we're at the very beginning of this in terms of cases and the spread, and we're going to see pretty sharp uptick in cases throughout the county and probably here in East Hampton as well. The virus has been here for some time, and, partially due to the lack of testing, the inability to get tested, we haven't really been able to get a handle on just how widespread it is. another reason why we need to just shelter in place and avoid each other as much as possible, because we don't really know how widespread. But we're seeing in the numbers, and I think there's an idea that this surge will continue over the next 21 days, and we'll peak at some point during that time. It could be in the next couple of weeks, but we're seeing a pretty sharp increase in the number of cases. As of yesterday, we had 2,260 cases in Suffolk County. That's up significantly in the last couple of days. They're countywide. They're now 17 deaths. We had 13 cases confirmed on the call last night. However, I have some anecdotal information that there are actually 15 now, and by the call with the county executive later today, I expect that number will increase.
Right.
There is now a mobile testing site in Stony Brook, and you need to call ahead if you need to get tested. They'll pre-qualify you for you to go there. All that information is on the town website. I would encourage people to, look at the town website. It's www.ehamptonny.gov. We're putting up continual updates, pertinent information here in town about what the town's doing, what services are available. I want to say that one of the really encouraging things about living in a small town is just how everybody comes together to help each other out when times get tough. And it's really no different now. That is our greatest resource. I mentioned that before when we were on together. We have food pantries that are meeting people's needs at this time when they're out of work. Those numbers have increased. Obviously, the number of clients they're all seeing has grown exponentially. And it's important to support them, and people can do that monetarily. Again, visit the website. We have links to each one of the local food pantries. The Justice Department has been doing God's work, really. We have a number of senior clients and those with particular special needs that we've been providing meals for. We've been doing critical shopping in some cases for shut-ins if they need prescriptions picked up or need some groceries picked up. We're also dropping off frozen meals. We're working with Meals on Wheels to provide food as well. You can call the Human Services Department for more information at 631-329-6939. That's 329-6939, and they can help you out. If you know people in the community who are shut-ins, we're also doing a call list. All the clients on that list are getting called at least every couple of days just to check in, make sure they're okay. And we have a number of people who've called us to volunteer to help out in various ways. And so we're putting together a master list of those who have resources or have time.
That's fantastic.
So
that was my next question, is what people can do to help. Because you said the other day, and I thought this was great, the best way to help is to keep yourself healthy and keep home.
Yeah.
And I thought that was very,
Yeah.
a very, very good sage advice, considering that if I go out and I break my leg, I am going to, cause the system to overload just from right there. So I thought that was really great. And I know that people are dying to figure out how to help, and they want to. And this community is really working very hard to do that, I think.
Right. Well, as I said earlier, that is the easiest way to really help to reduce any potential additional stress on the system. But again, if you are able to volunteer or have resources that you'd like to provide, you can call us at Town Hall, and we're putting together sort of a master list of folks and organizations who are standing by to help and to be able to plug in these resources. The town board is also looking at putting together some resources to deal with what will inevitably come in terms of business assistance and business recovery planning. Many of our businesses are seasonal. We don't know what kind of season we're going to have this year, if we're even going to have a season.
Right.
That remains to be seen. Hopefully we will. But there's also additional resources that are being brought to bear from the county, state, and federal levels as well. I was pleased to see that a recovery bill was passed by the Senate unanimously. It's nice to see that when things really get bad, that we can still come together as one nation, one people living together for the benefit of all. So hopefully that dynamic will continue. We'll be able to get more things done. Locally, we've been extremely busy. As I said, just connecting with our hospital, being in touch with them about any needs they have and what their plans are, getting updates from them. We have our Human Services Department going full blast. We also have daycare that's for the children of essential workers, in particular healthcare professionals and emergency responders. And this includes school-age children as well, and that's being offered at Eleanor Whitmore Early Childhood Development Center. And you can contact them. Their email is ewecc.org. And again, if you need any of this information, you weren't able to jot it down in time, go to the town website, and there are links to all these various organizations. As you probably know,
at the end too of this.
Yeah.
One. I think you guys are having the town board is having a meeting tomorrow that will be on LTV Live. That will be just you. And can people call in? Is that what's happening?
We're not
people
having
can't
a
call in.
call in. They can send emails. We thought best at this point not to take a direct public comments over the phone. People could and have been sending their comments pretty regularly, questions and advice to myself and to other town board members, as one would expect. And we've been handling those many requests and inquiries pretty efficiently, I would say, for the most part. Again, we're going to tomorrow focus on some of the steps the town has taken to date and what services are available, what issues and concerns that we need to be talking about moving forward. And then we also have just some essential business, which we'll conduct in exec session regarding litigation and contracts and personnel issues. So mostly tomorrow it's an update. We'll have discussion about what emergency preparedness in conjunction with my office and the chief of police have been up to, and just pretty much bring everybody up to date.
Okay,
Gives the town board an opportunity to meet together and discuss in one place, because open meetings law would require that we do that in a public forum. Again, we'll have a televised meeting on LTV, and we appreciate all your help in helping us effectuate that.
You're very welcome.
Members will be dialing in remotely like we're doing right here now.
It's pretty much
then
this format that you'll have, but with 6, I think, boxes.
Right, six spaces.
Well, Peter, thank you so much. Is there anything else? Any final words?
So I would just like to say and reassure people that we're going to get through this. It's going to be okay. It's going to take us a while, and it's going to require some patience and some self-sacrifice. And I think somebody had said the other day, and I thought it was pretty apropos of the situation, that citizens in the past have been called to serve their country and to protect their country, and many of them have sacrificed their lives to protect us. And really all we're asking you to do to sacrifice is just to stay indoors and sit on your couch or whatever for a while. Let's just chill this out, make this virus slow down so we're not overloading our health system. And, we're going to pull together. We can bring resources to bear for those in needs, just to serve those. And again, I just wish everybody to stay safe and healthy and stay calm. We're going to get through this. I want to thank LTV. You've been updating the crawler with the messages that we've been putting out, and that's really helpful at this time. So
Well, you're
thanks,
very
everyone.
welcome, Peter. Thank you. Okay.
Stay
Bye-bye.
safe.